Amanda, and today I will be performing drawing up insulin for BSN 225, the skills video, and I have gathered all my supplies. I have my patient, my insulin, my syringe, that's the 29 gauge by ½ inch with 100 units syringe, my clean gloves, my alcohol pad, my gauze. This is my sharps container for now, and my hand sanitizer because I'm currently traveling and not home, so just using what I have. And now that I've gathered all my supplies, I have my regular insulin, and my NPH insulin. And then first I will go ahead and verify the 6 rights of medication, which is the right dose, right time, right route, right medication, right patient, and right documentation. And next I will go ahead and check the order in the EHR from the doctor and make sure it matches the MAR before I begin anything. Just double check that the MAR and the order from the doctor says 4 units of regular insulin and 8 units of intermediate insulin, which is the NPH, to add up to a total of 12 units of insulin today. And then this will all be before breakfast for the patient. And then before I go to my patient, I will go ahead and knock on their door, close the door, or introduce myself, close the door behind me for patient privacy, go ahead and perform hand hygiene, let them know, hi, my name is Amanda, I'll be your nurse today, per your doctor's orders. We're gonna go ahead and, go ahead and give you some insulin today before breakfast, or breakfast should arrive soon, just let them know, and then explain what they're doing, and then also verify their first and last name and date of birth, and make sure it matches their wristband if they are in the hospital, and then ask if they have any allergies, and they say no, which is great. So just let them know that I'm here to draw up insulin and give them insulin for diabetic management. This go ahead and helps the glucose enter the cells and gives the body and the cells more energy. There are common side effects, so I'll just let them know about that. Dizziness and nausea could occur. And adverse side effects that I need to know about immediately if they happen is severe hypoglycemia, and also, which is low blood sugar, and also hives, and also let them know to let me know if those happen immediately. I went ahead and checked their level of glucose. It's about at 160, which is appropriate for the level of insulin, and their breakfast should arrive soon, so it's about perfect time for them. And going to have another nurse come in and check and verify the order for me and make sure that it is 4 units of regular insulin and 8 units of intermediate, so it should be a total of 12 units today. And then she verified everything, great. Thank the nurse for helping me, and then I next will go ahead and do hand hygiene, put on my clean gloves, and we'll go ahead and get the process started. So now that I have my gloves on, I will go ahead and pick up the vials and just kind of warm them up in my hand, mix them up a little bit, make sure everything's okay. Just do that. And then I will go ahead and clean the tops here. That's the trash. So go ahead and clean the tops. Great. So now that's all clean, and I'll let that air dry. I will go ahead and open up my insulin syringe. Again, it's a 29 gauge by ½ inch. Go and do that. And with the cap still on, I'll go ahead and drop 8 units. Here it is, 5, 6, 7, 8 units of air. Perfect. And this is gonna go in the intermediate NPH insulin. So next I will go ahead and just put that, insert the air, take it out. Next I will go ahead and do 4 units and enter that into the regular, put that in, that was quick. And next I will go ahead and draw up 4 units of regular insulin. This one's really hard to see. It's okay if you draw up a little bit more and just go back to 4, and if there's any air bubbles, go ahead and tap them out. Right now there's no air bubbles. Great, so I have 4 units of regular insulin, and since I already did the 8 units of air into the intermediate, I can go ahead and draw up 8 units of NPH to make a total of 12. There's a little bit of bubbles in here. Okay, so that is all done. That is ready to go. And I will go ahead and recap one-handed. I'll try to go ahead and show you. There's 10 units in here, but it's kind of hard for you to see. I'll go ahead and recap with the one-handed method. Great. And then I'll go ahead and alcohol swab my patient's skin and go ahead and insert the insulin. So, and if it is drawn away from the patient's bedside, I will go ahead and label it with the patient's name and the dose of both insulin, and then obviously administer it. And then I can, once that's all done, I can go ahead and remove my gloves, do hand hygiene, document in the EHR, and ask my patient if they have any questions, verify that it is the right medication, the right patient, the right dose, the right time, and the right route, which is the administration site. And then thank my patient, make sure they're all comfortable, give them the call light, and see if there's anything else I can do for them. If not, I will go ahead and leave. Thank you.